Homeopathy is a system of alternative medicine developed in 1796 by Samuel Hahnemann, based on his doctrine of like cures like, a claim that a substance that causes the symptoms of a disease in healthy people would cure similar symptoms in sick people. Homeopathy is a pseudoscience, a belief that is incorrectly presented as scientific. Homeopathic preparations are not effective for treating any condition. Large-scale studies have found homeopathy to be no more effective than a placebo, indicating that any positive effects that follow treatment are only due to the placebo effect, normal recovery from illness, or regression toward the mean. Hahnemann believed the underlying causes of disease were phenomena that he termed miasms, and that homeopathic preparations addressed these. The preparations are manufactured using a process of homeopathic dilution, in which a chosen substance is repeatedly diluted in alcohol or distilled water, each time with the containing vessel being bashed against an elastic material, commonly a leather-bound book. Dilution typically continues well past the point where no molecules of the original substance remain. Homeopaths select homeopathics by consulting reference books known as repertories, and by considering the totality of the patient's symptoms, personal traits, physical and psychological state, and life history. Homeopathy is not a plausible system of treatment, as its dogmas about how drugs, illness, the human body, liquids, and solutions operate are contradicted by a wide range of discoveries across biology, psychology, physics and chemistry made in the 2 centuries since its invention. Although some clinical trials produce positive results, multiple systematic reviews have indicated that this is because of chance, flawed research methods, and reporting bias. Homeopathic practice has been criticized as unethical because it discourages the use of effective treatments, with the World Health Organization warning against using homeopathy to try to treat severe diseases such as HIV and malaria. The continued practice of homeopathy, despite a lack of evidence of efficacy, has led to it being characterized within the scientific and medical communities as nonsense, quackery, and a sham. There have been 4 large-scale assessments of homeopathy by national or international bodies: the Australian National Health and Medical Research Council, the United Kingdom's House of Commons Science and Technology Committee, the European Academy's Science Advisory Council, and the Swiss Federal Health Office. Each concluded that homeopathy is ineffective, and recommended against the practice receiving any further funding. The National Health Service in England has announced a policy of not funding homeopathic medicine because it is a misuse of resources. They have called on the UK Department of Health to add homeopathic remedies to the blacklist of forbidden prescription items. The theme of the convention is enhancing quality research in homeopathy through scientific evidence and rich clinical experiences. The convention will have around 5 scientific sessions where experts of national and international repute shall be deliberating on key areas of homeopathic research, strengthening college infrastructure for undertaking research along with latest trends in drug validation, prognostic factor research, role in public health and epidemics by means of high-quality research including NABH accreditation of homeopathic hospitals. The main objective of sessions is to educate all stakeholders to understand the intricacies of homeopathic research and to provide adequate exposure of quality research environment to medical colleges, practitioners, clinicians, and researchers, said a statement from the ministry. The founder of homeopathy, Dr. Samuel Hahnemann, was the real advocate of logical reasoning. He based his discovery of homeopathy not on hypothesis alone, but on repeated testing of his hypothesis on healthy subjects and scientific maintenance and keen analysis of all his observations. He deduced from what he observed, but not before he could critically analyze his own work, contemplate on the whys and why nots, and then after enough introspection, and adequately convincing the rejectionist in him, he accepted his practical observations and deciphered time-tested theories from those. World Homeopathy Day, celebrated the world over to commemorate the birth anniversary of this legendary scientist, provides an ideal opportunity to stress upon the new possibilities in the global health scenario if homeopathy is integrated in mainstream public health. With World Health Organization emphasizing on the need of universal health coverage, UHC, homeopathy has a lot to offer to the world as it is economical, safe and effective. Homeopathy is widely popular and recognized in India and has been integrated into the national healthcare systems.